Good morning, friend. After the last 4 episodes, this is the 5th episode in which we will discuss the treatment of dry eyes. In last 3 episodes, we have understood whether you are a patient of dry eyes, how to understand the mechanism of dry eyes, and how to evaluate your dry eye. And in the 4th episode, we have discussed how you will consume different types of lubricating drops, gel, the oral medications, and the hot fomentation and lead massage, how you can do at your house. Now in this episode we will discuss the procedures which we do in our clinic to help you get rid of your dry eyes. The third part of the treatment consists of these procedures, which are IPL, LipiFlow, the kind of a bud where we squeeze your glands, your lids, to get rid of those blockages with the help of the bud or sometimes a small forceps, and these are done in the OPD. So what is this IPL and LipiFlow? IPL stands for Intense Pulse Laser Therapy. It is kind of a laser which is 101% safe for your eyes, and it is applied in forms of some mask on your eye, on your face, and it has some electrode also which will deliver some kind of a small currents to laser currents to your face in particular points. So what this does, it directly acts on your glands, their ducts, and help in opening of those blockages. They are usually done in 1 to 3 settings depending upon the severity of your dryness. The duration between these 2 settings can vary from 2 weeks to 4 weeks. And after this setting, some kind of mild anti-inflammatory or low-potent steroids are given along with your usual dry eye treatment, lubricating drops, and your gel. The another form of treatment is LipiFlow. The basic principle for IPL and LipiFlow is same, that it helps in getting rid of the blockages of this oil gland. So LipiFlow will have some kind of instrument which will help in pressing this gland, and it will manually squeeze this, and it will also heat up this gland. So these 2 procedures will give you an instant relief from those blockages. But remember, you are not going to be symptomatically better immediately. It takes about 1 to 2 weeks for the complete recovery, and after that, depending upon your symptoms, we decide whether to go ahead with the another settings or not. There are some procedures done in the OPD on the slit lamp where if we find there are some blockages which we can remove just by squeezing your eyes with some cotton bud or some instrument, then we prefer to do it in the OPD. The 4th form of treatment is consist of the surgical treatment, which none of you would want to go ahead. So if you have any dry eye symptom, consult your doctor, take the other first 3 forms of the treatment, so you need not to go ahead with the 4th form of a treatment. In the surgical form, depending upon the type of dryness you have, whether you have a reversible or irreversible kind of a dryness, we do the punctal plug and punctal cautery. There are some opening on the medial side of your eyes which carries the tears from your eyes to your throat, and these openings are blocked either by the plugs or doing cautery, like burning these holes so that they get permanently closed. And it is completely decided by your physician whether to go ahead with punctal plugs or a cautery. There is a link attached in the description box which describes about the punctal plug and punctal cautery. There are some other procedures depending upon the type of dryness, like some stem cell transplant is done, and other form of treatment are also there. The last one and the most important and the recent form of a treatment is the scleral contact lenses. Those patients who are not getting better even with all these forms of treatment, there are specialized type of scleral lenses. They are bigger in the size, rest on your white portion of your eye, and they holds up some saline. So with the saline, you are applying these lenses on your cornea, and this saline take care of your dryness. But sometimes even over these lenses you need to apply some lubricating drop. but at least the photophobia, the sensitivity to light, and the number of drops are get reduced after the use of these clearer lenses. Patients with the other form of diseases like rheumatoid arthritis, Sjogren's syndrome, they need some immunosuppression to decrease the symptoms or to decrease the severity of your dryness. So dry eye as such is not a straightforward condition. So let your physician decide what is best for you and get a best help from your physician. Thank you. Take care.